Today is the first day of the Harris County mandate requiring everyone over the age of 10 to wear a face covering while in a business or commercial property. That includes employees and all visitors as well as customers. And as we say in the city of Houston, mask up, and it's critically important for everyone to mask up in this city. And if I can add, not just to people going to businesses, but quite frankly, if you're out and about and in close proximity with other individuals, let me strongly encourage you to mask up. Because wearing a mask can help slow transmission of the virus. It protects other people from you. It can help save lives, and quite frankly, it's a sign of respect for other people as well. It does not matter if you wear a traditional mask or a bandana, as long as you wear an approved face covering and continue to social distance, that will help to save lives. Non-compliance with the order includes a $1,000 penalty for violators, but our goal is to save lives through education rather than enforcement and fines. Today we have another grim reminder that the virus is very much alive in our community and that our numbers are moving in the wrong direction. The Houston Health Department reports today 1,789 new cases of COVID-19 today, bringing Houston's total to 14,322. And let me repeat that again. The Houston Health Department reports today 1,789 new cases of COVID-19. We are moving very fast in the wrong direction. And let me just pause to say this. In March and April of this year, when these numbers were being reported in high numbers across the United States, in Houston we had worked together very diligently and intentionally to flatten the curve and to slow the progression. And even though this number includes Sunday as well as today, because we don't report on Sunday, so Sunday as well as today, the average is over 850 cases for Sunday and Monday. During March and April and May, I never reported these type of numbers. Never. Okay? We work diligently and collectively to flatten the curve and slow the progression. But as we have opened up the way we have, we are moving very fast, and we are moving very fast in the wrong direction. Today's positive numbers are cumulative for the 2 days because the Health Department again did not report on Sunday. And this count includes a large data feed from the Department of State and Human Services. 86% of these tests were conducted in the month of June, with testing dates of June 9th through the 17th. But be that as it may, on Friday I reported over 900. On Saturday I reported 844. And today, for Sunday and Monday, I am reporting 1,789. Sadly, the number of deaths increased by 5 to 196. And the 5 new deaths reported today: an Asian male in his 70s with underlying health conditions, a Hispanic female in her 70s with underlying health conditions, a white female in her 90s with underlying health conditions, a white female in her 80s, underlying health conditions, and a Hispanic male in his 70s with underlying health conditions. Of the 196 deaths, 53 are associated with nursing homes and 3 with the Harris County Jail. We cannot become lax within our city. thinking that the virus is no longer a threat. Positive cases are increasing in our city exponentially. Baylor College of Medicine, Dr. Peter Hotez said that Houston would become the worst affected city in the United States, maybe rival what we're seeing now in Brazil, if we do not reverse the trend of positive cases and increases in hospitalizations. And so let me speak directly to the people in our city. The numbers, yes, are increasing across the state. The number of hospitalizations are increasing on a daily basis. The number of people testing positive, yes, we're doing more tests, but the number of people testing positive, that number has significantly increased. And the course that we are currently on is not one that's in the best interest of our city and neither in the best interest of our state. At the very minimum, what we are asking people to do is to put on their masks or face coverings when you're going to a business, commercial establishment. That's the order that's in place right now. But I want to go even a step further, and I want to encourage every Houstonian that when they find themselves in the company of someone else, that they become very intentional and put on their mask or face covering as long as they're in the presence of someone else. That is the very minimum. That is the very minimum we can do. And we've been saying that for quite some time. And quite frankly, even that may not be enough to stem the spread of this virus. And so it is important for people to take this virus very carefully, seriously, and then understand that the percentage of the number of people impacted by this virus, that younger population, that number is increasing as well. And so for all of the individuals who are attending these bars and clubs with no mask on, in close proximity, you know, you may not have the virus, or you may be asymptomatic, but it doesn't mean that when you go home to your parents or to your grandparents that you may not be a veteran and carry this virus to them and infect them with this virus. Their immune system may not be as strong as yours. And so all of the good work, the disappointment for me is that all of the good work that we did collectively in March and April and in May, but all of the good work that we did, shutting down, closing conferences and conventions, with all of that good work, we are now engaged in opening and activities that are we're wiping away the success that we collectively achieved and the sacrifices that people made in March, April, and in May. So let me pause, and now let me bring up Dr. Peirce.
Thank you, Mayor. As the Mayor points out, the testing numbers are going up. The numbers in hospitals are also going up. And we're seeing this in some of our data. Here's the screen. So this is a screenshot from the Southeast Texas Regional Advisory Council data. Now this shows the hospital data for Harris County alone. And you'll notice that there are 647 COVID positive patients in the general and isolation beds. That was 233 on May the 31st. So since May the 31st to today, that is a 2.8-fold increase in the number of patients that are hospitalized just since May 31st. If you look at the ICUs, today there's 337 COVID positive patients in the intensive care units. On May the 31st, that was 205. So that's a greater than 1.6-fold increase. You'll also notice, and it makes sense to you, that there is a little bit of a lag between when the general hospital beds go up, and those numbers go up, and then the ICU. That's because, on average, patients who are admitted to the hospital will be in a regular bed generally 8 to 10 days, And at the end of that time, they either get better and go home, or they get worse and wind up in the intensive care unit. So the slope of the curve that you're seeing with the general and isolation beds, I anticipate will be mirrored over the next coming weeks in the ICU beds. If we go to the next slide, we'll take a look at similar data from the Texas Medical Center group. Remember that this is not just those hospitals on Fannin Street. This is the Texas Medical Center hospital system. So this includes all of the Memorial Hermann Hospital system hospitals, both of the Harris Health hospitals, all of the Houston Methodist hospitals, Baylor St. Luke, etc. Those hospitals span out over about a 9-county region. And so this graph represents the ICU occupancy trend for most but not all hospitals across 9 counties. So this is not just a Harris County issue. And again, you can see that steep increase in the number of patients admitted to the intensive care units that are COVID positive. And you will note that they are quoting that it's approximately a 4.1% daily growth in the occupancy of the ICUs. If you were to look at all the hospital beds, to include ICU, general, and isolation, it's about a 5.2% growth. And currently, about 13% of all beds are occupied with COVID-positive patients, including 24% of all the beds in the intensive care units. So the situation is serious, and then as the mayor pointed out, the numbers are moving in the wrong direction. We are working with hospitals closely. CETRAC, as well as the health departments, are working with the hospitals. The hospitals are not all filling up at the same rate. We have several hospitals in the Houston area that are already at and beyond capacity, and there are empty beds in some other hospitals, and so we're trying to even that load. And so we're moving patients between hospitals to try and relieve that. But the reality is that when you look at that and you look at where the hospitals are that are full or near full, they tend to be centrally located, in the hospitals with capacity, perhaps not to much surprise, are more peripheral to the city and out in the suburbs and further out communities. So the goal all along has been to make sure that if somebody needed a hospital bed, that there would be one available for them. So that's what we're trying to do. However, there is a limit to the number of hospital beds that we currently have, and hospitals are seriously considering activating their surge plans. The one challenge with those surge plans, they are very resource intensive, and it's probably not something that they will be able to do for a long period of time. So we have got to act now as a community. We have got to act now if we want to change the slope of this curve. And the last thing I want to point out is that one of the challenges is that the hospitals have a need to do elective surgeries. Elective surgeries is how hospitals make money to then offset the money that they lose taking care of other patients. That's why in the governor's order, he specifically prohibited elective surgeries. It was highly effective in that it created a lot of capacities in the hospital. It was also extremely expensive and an economic challenge for the hospitals. So I would like to plant the seed in the conversation that that is a fixable problem. Today, hospitals are struggling. They need to continue doing elective surgery to make up the money they lost, to offset what they're losing, taking care of viral pneumonia patients. But in America, we need hospitals to be financially incentivized to take care of viral pneumonia patients. This is a human decision. There are people who make those decisions. Those are business decisions that are made. Every flu season, we have the same conflict, that hospitals are full, yet critically ill influenza patients come into the ER where they have to wait until a bed opens up upstairs. There's no financial incentive for hospitals to take care of patients with influenza pneumonia that are critically ill, and now COVID pneumonia. So I put it to those that make those decisions, probably starting with CMS, to reevaluate the financial alignment of what incentivizes hospitals to take care of what types of patients and what types of patients America needs to be cared for today, which are the COVID, pneumonia, and other complication patients. Thank you, Mayor.
Thank you very much. And I want to emphasize that someone asked me the other day, Mayor, what more are you planning on doing to curb the increase of COVID cases? And what I responded is that the only thing that's within my arsenal at this moment is to be able, for example, to enforce the order that Judge Hidalgo put in place, but the city put an order in place that says the same thing for people who are attending commercial establishments, businesses, for their employees and for their visitors, that you need to put on the mask. But I do not have the ability or the authority to apply that across the board to individuals who are just out and about in large gatherings don't have the authority. Don't have the authority, for example, to tell anybody to stay home. That has been taken away from all of the counties, all of the cities. We don't have that authority. The only thing that we can do at this point, other than the order for businesses and to mask up, is to engage, to utilize our voice, and to encourage people to do the right thing. That's the only thing that we are able on our end to do. Chief Pena.
Thank you, Mayor. So before I get into the enforcement aspect, I want to expand a little bit on what the Mayor and Dr. Peirce mentioned in regards to the number of hospitalizations. Those patients primarily are getting to the hospital via 911, our ambulance service. In the last week, we've seen an increase in the call volume of about 20%, and that's significant. The downstream impact that these oversaturation in these hospitals is having on public safety is an issue, and it will continue to be an issue. When our ambulances are waiting at the hospitals for an hour plus, waiting to transfer the patients because the hospitals are saturated, that has an impact on us being able to service the next call for service, the next emergency call. And that has a domino effect on our capacity. So it's critical that we understand that. In addition to that, the impact to public safety is going to be felt in the number of personnel that fire department and the police department has available to come to work and fill the need for staffing. I'm not going to put a good picture on this. It is getting critical. The number of police officers that have tested positive for COVID-19 is at 146. 146 police officers have tested positive for COVID-19. 52 of those have since returned to work, but they do have 103 officers right now that are currently in quarantine, and they're not available to show up to work and staff these units. For the fire department, the numbers are even more pronounced. Over the last 10 days, our number of personnel in quarantine has gone up by over 140%. Just 10 days ago, we were at 36 firefighters in quarantine, and 2 of them that had tested that were recovering at home. At this point, we have 88 firefighters. We have 2 firefighters that are admitted into the hospital. One of them is in ICU. So the impact of us not doing the right thing as a community is going to be felt in our ability to staff our units. It is going to impact public safety. We're already understaffed, both police and fire department. But as we worked to address that, we're dealing with the reality today. And when you take hundreds of firefighters or hundreds of police officers off the street for quarantine, it has a definite effect on our ability to staff our units and service the calls for public safety in this community. So again, we want to ask the community to do the right thing for Houston. Proper hygiene, physical distancing, wear your masks. It's not about control, it's not about being overbearing, it's about doing the right thing for this community and for those that are responding to your emergencies. So we want to ask that you assist us in assisting you all. In regards to the enforcement for the order, our profile and our posture is going to remain the same. The occupancy task force goes out based on complaints. We don't have the staff to go out and patrol, so we work based on complaints. We're averaging about 70 to 80 calls for service per day, every 24 hours. What the approach that we've taken from the fire department is that we're going to go out there and educate and gain voluntary compliance. We are not issuing, to this point, we haven't issued any citations. But we also haven't left the scene or the location without addressing the issue. Okay, I think that's a better approach, and we've been successful. We've gained almost 100% compliance in regards to the occupancy in these businesses. Primarily, it's been clubs and bars that are our main demand. But we will remain in that posture unless some changes. We are going to respond. We're going to try to gain voluntary compliance. We will assist the management and the building owners to get into compliance. But again, it's about the safety of this community. To individuals, if you go into these places and it doesn't look safe, I would recommend that you go and spend your money somewhere else where they are maintaining the proper hygiene and the proper safety measures. So with that, Mayor, that's my report. Thank you.
Again, social distancing, proper hygiene, sanitizer, washing your hands, putting on the mask, and again, just let it sink in. On Friday, we reported over 900 cases. On Saturday, we reported over 800 cases. And on today, we're reporting 1,789 cases. That's not Harris County. That is within the city of Houston. And during this entire pandemic, we never reported those type of numbers. Never. Okay? So it's serious. And we're moving in the wrong direction. So we have to reverse course. And one thing we know, this virus loves company and closeness. So we need to separate. Okay? All right, we'll pause and take whatever questions you all may have.
Mayor,
Sure.
I think you have seen, or perhaps a breakdown of what the governor just talked about. Obviously, we're in a new mask order, and he did talk about possibly having to slow down depending on what happens with some of the reopening. If you or city or county leaders had the authority, what would you guys do now? Would you reinstitute closing down bars, or would you peel back, capacity? What would you do if you had the authority?
Well, what I would say to you is that I would have stayed with the course that was working well for the city of Houston and other cities in the state of Texas. When other cities like New York and Seattle and so many others, when their numbers were just big numbers of people testing positive, number of people who were dying, our numbers were very, very low in the months of March and April. When they shut down, we shut down. And so if you look where they were, where we were on the low end, and people nationally across this country were talking about our numbers. And then our power on the local level was stripped away, and we started opening up. I said 2 months ago that I thought we were moving too quickly, too fast. And now we find ourselves where we are today. The only tool that we have at our disposal is to say to businesses, we can require you to put on masks and for your employees and for your guests. We can use our voice, and that's what we're doing, but that's within the state's control on what it does.
Are you concerned, talking to the medical professionals, do you have a time frame about realistically when you might have to go to the county's code red or perhaps stand up, a portable medical facility like an NRG and things like that? Are you worried that we might be at that point in a couple of weeks?
Well, let me just say, I'll leave whatever the county should stand up to the county. That's a county decision. That's not a city decision. I do think it's important for the governor and the CEOs of the hospitals in the city of Houston and across the state to be working together, because they work together at the very beginning. As things were opening up, they need to work together now. So they need to figure it out. Between the governor and the CEOs, they need to figure it out. Having said that, let me yield to Dr. Purse.
And Dr. Purse, as you walk up, can you also address the point of, we always hear about there is bed capacity, but just because there is bed capacity, perhaps we shouldn't fill it all up or open to what's that argument? How does that square with you?
Yeah, you're asking an important and a little bit of a complicated question. So what we're seeing now is that hospitals are filling, but they're not filling all at the same rate. That's not a huge surprise. We see that every flu season as well. As the hospitals fill, we're trying to shift them over to hospitals where there is capacity. Now, when we have hurricanes and other disasters like that, this is the method and the tried and true practice that has been very good. The difference this time is that the hurricane, if you will, is affecting the entire state as opposed to just Houston. So we've moved patients across, this half of Texas during hurricanes, as far away as Dallas and Austin. So what's happening now is if you go to a remote county, a rural county that has a hospital that we usually can rely on, well, it's a small hospital generally, and they're filling up as well. So it becomes increasingly complicated. So the only thing that hospitals can do that was demonstrated with the governor's order to quickly create capacity, unfortunately, is to stop doing the elective surgeries. Remember, an elective surgery is a scheduled event, but it's also how the hospitals make money. And so, see, again, to my point, is that that's how hospitals stay alive. We need hospitals to financially stay alive because by doing elective surgery, it offsets the losses they have taking care of viral pneumonias. Well, that shouldn't be the case. Hospitals shouldn't be losing money taking care of viral pneumonias. They should be at least breaking even. And so there's where the conundrum begins.
Can you speak to the testing availability in Houston? I know the weather affected sites and things like that, but overall, are you seeing more people trying to get tested now because they're sort of freaked out? And are you guys trying to ramp up availability or the access to that?
Absolutely. So the amount of testing that we have has been relatively stable for the last couple of weeks. And for a while there, we weren't maxing out. We had, availability that was not being used. That is now different over the last 7 days, I would say, where we now are getting complaints of folks who are trying to get tested, but the testing sites are all full. At the same time, as the mayor pointed out, the positivity rate is going up. So while the total number of tests in Houston is relatively stable, we have no control over the private sites that may be popping up. Probably the greater factor that's pushing our numbers up is that the positivity rate has now gone from around 3% to around 9%. That's a threefold increase.
And can you talk about, Dr. First, sorry, another question from KHOU. They were asking about the turnaround to get results back at the city sites. Are you aware? Are they still 2 or 3 days, 1 or 2 days? Are there delays? Sort of, where are you guys on that?
Yeah, another good question. So for a while there, that was pretty reliably about a 2-day turnaround. That has lengthened again, and what I think is happening is that the FEMA sites are 2 stadium-based sites that they use the national labs. And so across America, there's a lot more people that are getting tested, so they're dealing with more samples than they were, say, 2-3 weeks ago. And so that's got them a little bit backed up. They send their results to the state, who then has to sort out which health department it goes to, and it comes to us. So now we're seeing a 5 to 8 day turnaround in us, the health department, getting the report. I'm hoping that the patients are still only experiencing about a 48-hour maximum time before they get the report.
Mayor, were you going to add something?
I was going to say, with respect to the testing issue, at the 2 largest sites, Del Mar and Butler, starting last week, they were reaching their maximum capacity, 500 each, somewhere around 10:30, 11 o'clock that morning. And so with the exception of today, on Saturday, Friday, Thursday, all of last week, a number of people were showing up, and by 10:30, 11 o'clock that morning, they were maxed out.
And Mayor, it seems like TABC has finally started doing some enforcement about bars and things like that we've seen over capacity. We saw one of the bar owners being fairly defiant on social media about the situation. How would you like to respond to business owners? I apologize, this is from Fox 26. How would you like to respond to business owners as well as others who are sort of pushing back against some of the TABC enforcements that's finally coming into play?
Well, number one, this is a healthcare crisis, and we're all in it. I mean, you heard Dr. Purse, the number of people testing positive on these cases, that percentage has gone from 3% to 9%. The number of hospitalization has increased. The number of people in ICU, that number has increased. The number of the younger population being tested positive, that number has increased. We're still reporting people who are dying. The day's number, 1,789 for Sunday and Monday in that number. So this is very real. This is a healthcare crisis, and quite frankly, your failure, for example, to wear masks or to engage in social distancing directly impacts on somebody else. It's a healthcare crisis. That's the only thing that I can point to. So nobody is trying to take away anybody's rights or liberties, but we are simply trying to keep everyone well.
From the Houston Chronicle, they want to know, either from you or Chief Pena, if businesses refuse to comply with mask order after they've been warned, and you've checked up on them, and told them nicely. What is the next step? When do you guys issue fine, report them to, the proper state agencies? And when does that happen? What is the
Well,
next situation?
I'm pleased to see that the TABC is moving forward, because if you take someone's liquor license and put them out and they can't sell for 30 days, that's a significant hit, and they will take notice. The plan initially now is to educate, make people aware. Then let's say after the next few days, if we still don't get compliance and people are still engaged in behavior that's contra to the order, then yeah, we'll entertain going to the next step. The reality is no one wants to do it, but I don't want the city of Houston to end up in a shutdown mode because our hospitals are being overwhelmed and people are dying, and that's what people are seeing all over the country. That's not what we want in the city of Houston. So if we are forced to go to the next step, then we will go to the next step. We don't want to, but what ends up happening will not be determined by me. It will be determined by our refusal to do the things to keep this virus from spreading, and it will be determined about the impact that this virus is having. So we're asking people to be responsible, but if people continue to, let's say they're engaged in these various establishments and totally ignoring what we know is not in people's best health interest, then we'll utilize the tools that we have. Now, they are limited tools, but we'll utilize what we have.
And we have time for just one more question. Is there anybody good?
And so I guess my only other question, maybe Dr. Peirce can talk about this, is what do you tell people as far as testing is concerned? Do you find it, we're at 9%, we're at 3 or 4%. How does that really impact people on the ground? Should they go get tested more? Are there enough resources out there for these folks?
So right now, I wish we had more testing capacity because we're maxed out. Right now, that was a phenomenon of everybody quickly paying attention. So that's good, right? This is a problem, but it's a good problem to have. So, but people need to understand what a test is. It will tell you if on that day whether or not you had the virus. Again, remember that if you have no symptoms, there is still a chance it could be a false negative. But if it's positive, you then need to think about who you've been in contact with for the past several days, and they need to quarantine. And it's the isolation and the quarantine. So we talk about testing, case investigation, contact tracing. It's all academic, if you will, until people actually isolate themselves, those that are sick and test positive, and their contacts quarantine themselves so that they don't spread the virus.
And
That's
do you
where the rubber meets the road.
And do you have advice for people about, because they see 15-minute testing, they see all these little emergency places pop up, then they see the city test takes 2 or 3 days. What's more accurate? What's less accurate? Should people trust one type of test over another? Because there's a lot of, advertisement things out there.
Yeah, so thank you for that question. The most reliable test is the test with the nasal swab, and it's a PCR, polymerase chain reaction test, and that takes minimum 24 hours to get back. The quick test, there is one, the Abbott ID Now, which if you get a positive result, that's reliable. But if you get a negative result, it is completely of no value at all because there's a high false negative rate with that particular test. So if you get a positive, you've got it. They don't have many false positives, but they do have a lot of false negatives. And then the other one, the finger stick test that are looking for the antibodies, that is, at this point, that is of really no value whatsoever. It will tell you if you had the virus some time ago. That does not mean that you won't get infected again. It is essentially, at this point, it is a completely unreliable result. They are working to make that more valuable, but today I have no utility for that test whatsoever.
And lastly, what I would say, get tested. If you've been around a group of people, okay, get tested. I think we still have about 27, if not more, different sites around, free, no charge. Please get tested. And then secondly, because I heard a case, I think this morning, if you test positive, please do not come to work. Okay? If you test positive, do not come to work. We don't need bartenders testing positive or weather workers coming to work. So if you test positive, you stay home, even if you're feeling fine. Okay? If you test positive, you stay home. If you're feeling sick, you stay home. Okay? You stay home. Okay? But I am hoping and praying that people in our city will exercise individual responsibility and engage in social distancing, proper hygiene, put on the mask, because it's only through our own individual actions, regardless of what tools we may have. The ultimate tool is in the hands of every single Houstonian. The ultimate tool is in your hands, okay? And so please, please, put on your mask and engage in social distancing, wash your hands, use sanitizer, and protect your loved ones, your friends, and your neighbors. Thank you all so very, very much.
We have just been listening to Mayor Sylvester Turner and other health officials, as well as the fire department chief, give an update on COVID-19 in Houston. Here's a quick breakdown of the numbers. 1,789 new cases over the past 2 days in the city of Houston alone, along with 5 new deaths. 14,300 in total cases, 322 cases now in Houston. The mayor saying emphatically we are moving in the wrong direction very fast. He said all the hard work we did in March, April, and May, we are eroding that success right now. He insists that folks should keep wearing the face coverings, which became a requirement in businesses starting today. We'll have the very latest on this. Follow it on KHOU.com, the KHOU11 mobile app, and coming up on the 411 at 4. We will see you then.
Nice Maine! Try my $5.99 South